Well, mercury poisoning is something that obviously really hits home with me. If you've read my story or if you heard my story, my debilitating illness that lasted at least 4 years of chronic fatigue, anxiety, sleep disorders, all kinds of bizarre symptoms that ruined my life, put me in about $180,000 worth of debt trying to figure out what was wrong. Well, it all started after I got a couple of amalgam fillings removed. And fatigue started shortly after that. I didn't know what happened. Unfortunately, it took me about 3 years to figure it out. But it ended up to be mercury poisoning. Look, there are many sources of mercury today. However, amalgam silver fillings are still the #1 adult source. I was wearing contact lenses in the 1980s, which was the #1 adult source of mercury, which the saline solution still contained mercury, which in the form of thimerosal. Which literally went right into the eyes, right into the brain. Mercury poisoning is brain poisoning. Most people talk about mercury poisoning as just being the mercury in the body. However, the problem is what's embedded in the brain. This is why it's very difficult to test for this situation. Matter of fact, the test that I did first, because I looked at something called Mad Hatter's disease. I saw all these symptoms of Mad Hatter's disease, and I don't know if you're familiar with this disease, but the people making felt hats were using mercury to keep down the mold population in the felt for the hats. Well, what had happened is they all became mercury poisoned and they all became mad as a hatter. Well, when I read the symptoms of mad as a hatter, that was me. So I immediately went to the best toxicologist in Pittsburgh and I said, I think I have mercury poisoning. He agreed. He ran a blood test. It came out negative. So of course I was disappointed. But what I learned later, it was the wrong test. Really, that only shows acute mercury poisoning. Chronic mercury poisoning, the mercury is embedded into the tissue, and it's very difficult to test for. However, I was told this is the correct test to do, so I ended up doing the correct test, finding out, in fact, I was chronically mercury poisoned from amalgam fillings, my contact lens fluid, and of course, even fish today plays a role. Look, there's a lot of sources. But so many practitioners today treat this incorrectly. So #1, please don't run out and get your silver fillings. Matter of fact, watch the video I did in the dental section. Don't run out and get them. We have a protocol for that. That's one of the things that put me over the edge. However, to get well, we have a protocol of not just removing these sources correctly, but removing the mercury from your brain and from your nerve tissue. Look, it saved my life. It saved thousands of patients that I treated. It saved their lives. And probably the most frustrating thing for me as a practitioner is watching how wrong and incorrectly mercury is treated, or at least the detoxification of mercury. There is a right way, there is a safe way, and there's a way that'll save your life.